I would like to start the next agenda. It is the session for discussion. So the first session is the most relevant for the time. That is the success story on capitalizing on media and creating COVID-19 awareness and vaccine acceptability. So the first moderator of this session is the renowned celebrity from India, is Dr. Kiran Bedi. Dr. Kiran Bedi, she is the first woman in India to have joined the officer ranks of Indian Police Service in 1972. Also the first woman to be appointed as police advisor to Secretary General in United Nations Department of Peacekeeping Operation in New York. She was appointed as the Lieutenant Governor of Puducherry and stood up for the people of Puducherry, be it for resourcing strengths against natural havoc like cyclone and depleting groundwater, or for directing and guiding the administration and the people during the unprecedented pandemic. Dr. Bedi believes that reformation has been a hallmark of her model of leadership. So Dr. Kiran Bedi, the floor is yours. Dr. Bedi, the floor is yours.
Good. Thank you, Philo, for inviting me and all of you organizers for giving me this wonderful, rare opportunity to moderate such a prestigious session, which is participated and contributed by very, very eminent speakers, whom I've been listening to and following myself. Friends, media has played an important role in shaping the global post-declaration of the pandemic. Media consumption spikes during crisis, and the COVID-19 pandemic has seen a surge in traditional media usage. Its ability to unify platforms for all public health communication, creating awareness and disseminating information will be a key factor in mitigating the impact of COVID-19, particularly with the current vaccine rollout in most countries. Governments must focus on utilizing media to communicate treatment strategies and build vaccine acceptability. We have some very great, with these opening remarks. The four speakers we have today are Dr. Randeep Guleria, Mr. Nasrullah Muhammad Irfan, Mr. Boris Ramirez, and Dr. Claudia Abreu Lopez. May I request, and we'll have rapporteurs in Mr. KP Madhu. Can I introduce the first panelist with me is Dr. Randeep Guleria. He is the director of the All India Institute of Medical Sciences. His topic is role of media and digital space in COVID-19 pandemic. Dr. Randeep Guleria is the director of the All India Institute of Medical Sciences. He's an advisor and a consultant to various international, national bodies. Otherwise, he's a very, very learned and a very eminent regular contributor to us. He's obtained several awards and honors, including the prestigious Padma Shri in 2015, Dr. B.C. Roy Award for Eminent Medical Person in 2014, various awards like Himachal Gaurav Award, ZTV Swastha Award, recently Times Healthcare Achievers Award in the Legends category, Doctor of the Decade Award by the Indian Medical Association, and National Excellence Award by the T.P. Jhunjhunwala Foundation 2017-18. He's delivered, Dr. Guleria has delivered more than 8 prestigious national and international orations and had published more than 450 publications. Dr. Guleria is on the national television and all other media every day almost, guiding, advising, suggesting, and mentoring. I invite Dr. Guleria to please make his presentation. Thank you, Doctor.
Thank you, Madam, for your kind words. And I'd like to start by thanking AIBD for inviting me over and asking me to give this talk. Uh, I am the odd man out, if I may put it that way, because I'm the only clinician that I can see in this panel, and a pulmonologist who has been involved in pandemic management or pandemic approach for more than 20 years. So I'll be quickly in the next 10 to 12 minutes covering on the role of media and digital space, focusing not only what has been done in predominantly what we have done as a hospital. We are the All India Institute of Medical Sciences is a university which has undergraduates, postgraduate students, postdoctoral students, and we also have a very large hospital of around 3,000 beds. So we are a university and a clinical center. So we all know that this is an unprecedented crisis, as was mentioned. And we had the first case of COVID-19 last year on the 30th of January. And from that time, a very proactive response has been taken by the states and the center, from travel advisory, surveillance guidelines, containment plans, the Epidemic Disease Act being invoked, and a lot of activities, including testing and vaccination. Media has played a very, very important role during the COVID-19 pandemic. And I think what is very important is transparent communication by the leadership. And this has led to compliance of requisite directions given to the masses, whether it be COVID appropriate behavior, whether it be the role of vaccination, or whether it be the containment zones that one was making. The awareness material that was generated by different agencies was disseminated through various media platforms. What has really been used is the print media, the electronic media, the radio, as was already mentioned, and also to a very large extent, the digital space and the social media to educate public and professionals. And this is where we came in a big way, that the All India Institute of Medical Sciences decided that we have a huge role to play, not only in patient care, but also in educating other doctors in the country in terms of how to manage COVID-19, which was a new virus. There were new management strategies in the beginning. No one really knew how to manage this disease. And at the same time, to really educate the public and also really and more recently the vaccine hesitancy. So what we did at the All India Institute of Medical Sciences, a portal was made and COVID videos were generated, which were put on our website and the Ministry of Health and Family website also, and on YouTube. We held many webinars. We held video conferences with our neighboring countries, Nepal, Bangladesh, the SAARC countries, and training programs were also had, and posters, various national guidelines were made, and we also started excellence programs and national EICUs. We also had a clinical grand round every Wednesday to educate doctors not only in our country but in the neighboring countries also. The government had regular press briefings, a dashboard was also created, and Twitter was also used to really be able to address issues, especially as far as fake news was concerned. As far as the institute is concerned and the government is concerned, we've been involved in giving almost 800 interviews in the electronic media, addressing various issues as far as COVID-19 is concerned, both from the point of view of the task force and issues that the All Institute of Medical Sciences was involved in. We had multiple news briefings. The government regularly had news briefings. They still have it almost thrice a week. And this is updating the policy and things that the government is doing as far as management of COVID-19 is concerned. The Institute also has been very actively involved in all of these activities. Experts from our faculty, including the Department of Pulmonary Medicine, Endocrinology in terms of managing diabetes in the time of COVID, Department of ENT now because of the fungal infection, mucormycosis, Department of Anesthesiology, Obstetrics and Gynecology, Medicine and Neurology, all were involved in basically having online programs with on the radio to educate the public in terms of their issues, and there was online phone-in programs also organized. We also very early had put in an information booklet on the digital space, which was COVID-19, be careful, not fearful. And this was done last year in March, so that we could really update the general public on the do's and don'ts as far as COVID-19 was concerned. An IAC portal, COVID portal was created at the All India Institute of Medical Sciences, both for doctors and for the laypersons in terms of how they could look at various issues in terms of COVID-19. We created more than 53 videos which were on our website and also on YouTube, on various issues to help the public. It was like COVID-19 in the elderly, the issues of stigma, which was related to COVID-19. How do you properly wear your mask? What are the ways of wearing, donning and doffing a PPE, and various other issues like the use of yoga as far as COVID-19 is concerned. These were also put up on the Ministry of Health and Family website, and many of these were done by cooperation from our own faculty. We also had webinars, and we took extensive teaching sessions, not only for doctors in our own institute, but across the country. And we looked at whether it was managing COVID-19, managing diabetes in the era of COVID, or looking at issues of home isolation or management strategies, especially as far as new drugs were concerned. This was also done through the Ministry of Health and Family Welfare in terms of large number of webinars that were held. Like I said, we also had activities for the neighboring countries, and we had management of COVID-19, infection control, biomedical management, and laboratory diagnosis, all done for our neighboring countries. And we had a very good response from the doctors, whether it be from Nepal, the Mauritius, or even from the Maldives. We started what was known as training of IEC training using the IEC platform in April 2020, and 14 mentoring institutes across the country were used for training doctors in terms of managing COVID-19. This led to almost 100 to 543 institutes were covered in what we call EICUs. I myself probably interacted with more than 50 or more than 500 institutes across the country, where we discussed management strategies, and we used the media platform to be able to communicate with doctors in various parts of our country for proper management of COVID-19. We also started the National COVID Grand Rounds, which was done initially on a weekly basis, covering topics which would educate doctors. And this was followed by question and answers from doctors. And this we did at an international level also with University College London, where we held 2 international COVID-19 Grand Rounds also. We also had the Center of Excellence program, which we held right now. This is something we started more recently because we realized that COVID-19 is now going into rural India, and we need to train doctors in rural India also. And therefore, using the platform of state centers of excellence, we started training doctors in various states so that they could start training doctors in rural India, both in the private and government sector, in management of COVID-19. And we created modules of 30-minute videos to be disseminated on mass media. We started a helpline, which was Contact COVID-19 National Teleconsultation, and also COVID email helpline, which is also very, very useful. So this is to give you a broad overview of the activities we did at the All India Institute of Medical Sciences as far as using the media is concerned and the public space in terms of educating people. Thank you very much.
Thank you, Dr. Guleria, for giving us a wonderful overview of what all was done under your leadership and your team by the All India Institute of Medical Sciences, and you as the director of the AIIMS. You've shared with the lead role in educating. I think what I've noticed is what we could do in 70 years, we've done it literally less than 2 years. We've sandwiched it all in less than 2 years. You've reached the nook and corner. I know how you were connecting with doctors even in Puducherry during my time. And therefore, we want to thank you for the stellar role you played and your team in educating till the last student. And I'm so glad to see as an Indian how we collaborated in the region, how we mentored and shared technical know-how. So thanking you for your stellar contribution, both in the past and the current. And I know what a strong communicator you are, because you are regularly mentoring through, and you never give up. You've got amazing stamina for communication. And that we, as every Indian citizen, we are very, very grateful. And so is the region. And so is the kind of television reach which now these platforms are giving us. So thank you, Dr. Guleria, once again, for your stellar contribution. I call upon now the second panelist. That's Dr. Nasrullah Muhammad Irfan. He's the Deputy Director General Programs of Bangladesh. His topic is role of media in COVID-19. He started his career in broadcasting since 21st January 1991. He worked in different stations of Bangladesh, Betar, as program organizer, assistant director, deputy director, regional director, director external services, director program, director music, director liaison, director farm broadcast, and finally promoted as director, deputy director general program on December 29th. He's 20. His responsibilities are to look after ongoing programs, planning activities of 14 regional stations of Bangladesh, better necessary directions for improving program quality, news and current affairs, promoting new media, social media and radio broadcasting, live broadcast, field reporting, budget allocations, HR activities, liaison with government and non-government organizations, and organizing different training for improving skills and office management. I want to appreciate, I attended the yesterday's session, and one of your honorable minister shared so elucidly the success story of Bangladesh. We have also been observing amazing success story from congratulate the government and your leadership for showing remarkable leadership and innovations and management strategies for COVID management. Thank you, Doctor. And now, please, could you please proceed with your presentation? Thank you.
Thank you, Dr. Kiran Bedi, my moderator, and Excellencies President AIBDGC Sri Mayank Agarwal, Director All India Radio, Director All India Institute of Medical Science, AIMS, Dr. Randeep Gloria, President Television America Latina, Costa Rica, Dr. Claudia Avirio Lopez, Research Fellow, United Nations University, Malaysia, member of the AIBD, and my moderator, Dr. Kiran Bedi, former IPS officer and former Lieutenant Governor of Puducherry, India. Good morning from Bangladesh and greetings from Bangladesh, Betar. Now, I would like to present the role of media in COVID situation in Bangladesh. As you all know, the current population of Bangladesh is 166 million plus, and the total density in the population density in Bangladesh is 1265 kilometer per square kilometer, and 39.4% of the population is in urban area, living in urban area. Now I would like to share my PPT. Okay. The COVID-19 pandemic in Bangladesh is a part of the worldwide pandemic of corona disease. COVID-19 is caused by severe acute respiratory syndrome coronavirus 2. The virus was confirmed to have spread in Bangladesh in March 2020. The first 3 known cases were reported on March 8, 2020 by the country's Epidemiology Institute, IEDCR. Since then, the pandemic has spread day by day over the whole nation, and the number of the affected people has been increasing. On 6 May, COVID-19 case was confirmed in all districts. Rangamati was the last district to repeat confirmed COVID-19. As you see in the screen, COVID dashboard shows the total infected number is 0.8 million plus. Number of deaths is around 12,660. 12,694, cured from corona about 0.74 million plus, and around 6 million tests done so far in Bangladesh. The initiative of governments to establish COVID-19
Dr. Irfan, your PPT is not on the screen.
I'm sorry.
Yes, now it's on.
Okay, okay. So let
Thank
me
you.
start. Let me start from the first one. Okay.
Please do.
Okay. Okay. Role of Bangladesh better in COVID-19 situations. As I said earlier, the COVID-19 pandemic in Bangladesh is a part of the worldwide pandemic of coronavirus disease 2019 caused by the severe acute respiratory syndrome coronavirus 2. The virus was confirmed to have spread in Bangladesh in March 2020. The first three known cases were reported on the 8th March 2020 by the country's Epidemiology Institute, IEDCR. Since then, the pandemic has spread day by day over the whole nation, and the number of the affected people has been increasing. May 6th, COVID-19 cases were confirmed to all districts. Rangamati was the last district to report confirmed cases of COVID-19. Overall COVID situation in Bangladesh, it shows in the dashboard that the total infected number is 0.8 million plus. Number of deaths as on yesterday, 12,694, and cured from the corona, 0.74 million plus. Around 6 million tests, 6 million corona tests done so far. COVID-19 related doctor suggestion information available at the National Call Center, Health Portal, IEDCR Portal, COVID-19 Telehealth, Ma Health Systems. Bangladesh Beta regularly disseminated this information from its 14 regional stations. And generally, any suspected COVID patient can call the center, get the adequate information from the doctors, and when anyone is COVID positive, the IDCR usually call the patient and give proper direction what to be done next. If it is mild, then they can take the treatment in the home. It is moderate or severe, or the saturation is below 92 or 93, then they are advised to contact with the hospitals.
Doctor, you got 3 minutes left. You got 3 minutes to go.
Initiatives during the pandemic: general holidays and closure all educational institute, lockdown, restriction of transport movement, restriction of all kinds of social and political mass gathering, closure of all shops and malls, market, given emphasis on health guidelines, including hand washing, wearing masks, keeping social distance, and many more. Government initiatives also, government initiative, COVID dedicated hospitals are in the screen, as time is very short, you saw. And for COVID registration, we have the portal surakha.gov.bd. Anyone can visit this website and can register him for vaccination. These are the formats of the surakha.gov.bd. Bangladesh Betar is regularly promoting this. And also we broadcast where the vaccination center, as you see all in the screen, the medical college and hospitals, city corporation health centers, district hospitals of Bangladesh, Upazila hospitals, and government stimulus package are food and cans incentive, proper marginal peoples, private enterprises, journalists, teachers, and many more. And the main thing is that Bangladesh Betar broadcast different type of programs like live phone programs, discussions, interview, talk, sport drama, composite programs, slogan, PSA, jingle, celebrity call, infographic program, news and news commentary. These programs contents are continue broadcast from its 12 regional stations program to inform the mass people the latest situation of the corona, and they get proper treatment facilities, and also where to contact when anyone is suspected for the COVID. A special program on children education, Khare Boshi Shiki mean learn from the home, is 1 hour, 5 days in a week broadcast area uh, uh, from 14 regional stations of Bangladesh. Department of Primary Education and Bangladesh are jointly implementing this program. The mode of broadcast is medium wave and FM wave, website, apps, and social medias, as you have seen in this screen.
1 minute to go.
And we are inform the people how to use the masks, how to maintain the social distance, and advice for stopping the virus spreading. And I also see the COVID test locations and awareness initiative, including we interview the doctor and specialist, respiratory specialist, mental health specialist, and broadcast their opinions from our Bangladesh Betar. No masks, no service is our message. Do's and don'ts of using masks and how to use proper masks. Awareness building program we broadcast from our, and finally you see the vaccine acceptability, promoting vaccine. We call celebrity call. We call it celebrity call. After their reaction, people are engaged, more engaged to get vaccine from vaccination center.
Thank you, doctor. Thank you so much, doctor. Your time is up. I think we may be able to connect with you more over the Q&A now, Dr. Irfan.
Yeah.
But I really respect the rainbow of initiatives you have taken and put up on the website. Thank you. I'm sure it'll be great value, Dr. Irfan, to the entire region, because culturally we are so much alike. Many of the things you were saying were literally overlapping with what Dr. Galeria also said. I have no doubt that the region will continue to benefit from each other's good practices. Dr. Irfan, thank you so much. Sorry, we lost your earlier PowerPoint points. Can I call upon the next speaker without losing any more time? Is Mr. Boris Ramirez. Mr. Boris Ramirez. He's the president of Television America Latina, TEL, Costa Rica, from Central America. His topic is media new opportunities, inoculate people with proper information. Boris Ramirez is currently the president of Television America Latin TEL in Costa Rica, Central America, journalist with 35 years of experience in national and international media. From 2014 to 18, you were the director of communication for the government of Costa Rica, university professor with 25 years of teaching, author of books about internet journalism and issues related to water and sanitation in Latin America. Over to you, Mr. Boris Ramirez from Costa Rica.
Thank you, Dr. Biri. You're very kind. Please put my presentation on the screen.
We got
Thank you. Thank you. Good night for Asia. Good night for America Latina. Good morning in Asia. Greeting from Latin America to the people who participate in this event. Next, please. Costa Rica is a country with over 200 years of history that is commitment to build peace, education, environmental protection, and the defense of human rights. That beautiful bird is called toucan, and is the inspiration for the logo of CINART, the public media system of my country. It represents our commitment with freedom, with nature, with creativity, and with color. Next, please. From Costa Rica, we have the honor of presiding over the Television America Latina. TOL is the union of the public and cultural channels of this powerful and inspiring region of the world. TAL base its words on the culture of cooperation with collective action, putting citizens in motion from integration, diversity, and innovation to enhance individual sovereignty for a quality television meeting. Next, please. The years 2020 and 2021 have been a global challenge, but TAL's channels have assumed this responsibility by sharing material in quantity and quality for the people that urgently needs information. These are just some examples of production from our partner channels. Next, please. This recent production is called Our Windows, Our World. It's an innovative format in which Latin American kids explain the pandemic from their point of view, voices, and realities, all from the windows of their homes. Next. Guarantee permanent, creative, democratic, and comprehensive information. Those are the pillars that continues to guide us in the world of public and cultural television in Latin America, based on the principle of guarantee freedom of expression, freedom of the press, and access to data, knowledge, and education with quality content. Next, please. We worked on this commitment from three postulates, which inspire us from the United Nations and Reporters Without Borders organization to promote and protect free access to information, provide people with truthful information in the face of so much misinformation and fake news, to give certainty and security, protect the health, integrity, and work of journalist teams during the pandemic. Next, please. We must strengthen our commitment with a television and multimedia possibilities that as communication system, we have as an obligation to. Next, please. Next. Next. Quality of content. Strengthening multimedia platforms for television, radio, and digital. Supporting access to technology for more people, families, and communities throughout the region. The production of innovative and creative educational options, elimination for inequality in access to education and skill for employment. Next, please. Fighting the fake news and misinformation pandemic to continue the path of consolidating free and open digital television. Next. After the pandemic, the world will have changed from the way we socially interact to the method of production and the way we see the world and other people. Next. This photograph summons us to the fact that we are all the vaccine. We must understand the vaccine as a world route which public and cultural television must also add to their agendas with global challenges, which studies as serious as those of the Economic Commission for Latin America, CEPAL, have pointed out to us, to pandemic and post-pandemic. Improved health service, for the entire people. Service of water, service of energy, service of technology, service of sanitation. Reform the education system so that is this comprehensive, inclusive, and democratic. Expand the offer and access to technology and innovation for people. Deepen and explain the change in employment and production so that more people join and have dignified life. Next. Thank you very much on behalf of Latin American television. We appreciate this space. You will always be welcome to Latin America, where we open windows of opportunity to improve the quality of life from public television and culture. As a Costa Rican, I invite you to visit it and to come to Costa Rica and to Sinar Costa Rica media. Thank you.
Thank you, Dr. Boris Ramesh. How colorful your presentation was. Your every slide was 1,000 words because it was so visible and colorful and artistic. I'm sure, yeah, it's going to add color to COVID. Though COVID itself, when you see the insignia, it's all colorful and red, how damaging it is. But yours is full of life and energy. Thank you so much, Mr. I have a habit of calling everybody doctor. Mr. Boris Ramesh, for giving us the Latin American perspective. I'm sure you will be there now for more of Q&A. I move on to the fourth eminent panelist. That's Dr. Claudia Abreu Lopez, Research Fellow, International Institute for Global Health, United Nations University, that's called UNUIIGH, Malaysia. Your topic is vaccine acceptability among Malaysian youths, debunking myths using U-Report chatbot. Dr. Claudia Abreu Lopez, now you are a doctor, I won't make a mistake here now, because I call the Bangladesh panelist also doctor. I'm sure it's a good upgrade, so upgrade is always welcome. So Dr. Claudia Abreu Lopez is a research fellow at the United Nations University International Institute for Global Health. Your research interests focus on community health and community engagement, the gendered aspects of digital technologies, and the structural determinants of gender inequities and their impact on health outcomes. You are a social psychologist with over 20 years experience in research in academia, NGOs, and the United Nations. You hold a PhD in social research methods from London School of Economics. Over to you, Claudia. Over to you, Claudia. Our fourth speaker, fourth panelist.
Just a moment.
Right. In this session, we have
Dr. Claudia is joining. Yeah.
Okay. Meanwhile, I just announced that we shall be sending the PPT to all the attendees for your information. And we have almost 24 minutes to go. So after Claudia's presentation, we will be able to interact a lot and have a lot of questions from our very important panelists. So is Claudia there?
Yes, I am here. Thank you very much.
Claudia, most welcome. Please go ahead.
Thank you for this very kind introduction and also for your excellent moderation. So I would like to thank the invitation to this event and also to my fellow panelists for the very interesting presentations that show the role of media to combat COVID-19 in different countries. So my presentation is focusing on Malaysia. I'm a research fellow at United Nations Institute, United Nations University, the International Institute for Global Health. That is a UN think tank on global health, serving as policy translation hub for the UN member states, the agencies and programs. So I'm going to present a project that we have been developing at the UNUIIGH with UNICEF Malaysia that is focused on the COVID-19 vaccine acceptance among Malaysian youth using a social media platform that is the U-Report to debunk myths about the vaccination. So in the first place, I will start my presentation just showing the overall picture in Southeast Asia of the vaccine rollout in the different countries, to point that when we look at these graphs and we look at the different curves, we need to take into account the supply and the demand side. So the supply has to do with the availability of the vaccines and the characteristics of the vaccine rollout programs in the different countries, but we also need to take into account the demand that is related with the acceptance of the vaccines. So the vaccine acceptance or hesitancy refers to the delay in acceptance or refusal of vaccines despite availability of the vaccine services. So we can think of the vaccine acceptance as part of a continuum where in one pole people accept all vaccines and the other pole people refuse all vaccines. So these poles are very unlikely to occur. So most of people are in a continuum between these two poles where they make a decision and they are willing about taking the vaccine that depends on the information that they have of the vaccine and also in terms of the urgency that they have. So what we can see is that vaccine hesitancy is not necessarily related to refusing the vaccine at all, but refusing to take the vaccine in a certain point in time or taking the vaccine depending on certain conditions or contexts. So when we think of a model for vaccine hesitancy, we take into account three different dimensions or components. So the most important is confidence in terms of being a determinant of vaccine hesitancy. So vaccine hesitancy has to do with the mistrust in the effectiveness and the safety of the vaccines, the mistrust in the competence of the health services and the health professionals, or the motivations of the policymakers who decide on the needs of the vaccine. Other dimension is related with the complacency. The complacency is related to the perceived risks and of the vaccine preventable diseases. In the case of COVID, has to do with the people negating that COVID-19 is a global pandemic. And then we have the convenience that is related to the willingness to take the vaccine depending on certain conditions, that is affordability, the availability, accessibility, and also the language and health literacy. So talking about the situation in Malaysia, there were several polls that were done in social media by the Ministry of Health. And one poll was done at the end of the last year, 2020, that showed that 67% of residents in Malaysia are willing to accept the COVID vaccine. And the total sample size was over 200,000 people. A new poll conducted more recently in April this year showed that this acceptance increased to 85%. So these polls are important. They are convenient samples, but they still show us that more than 0.5% of the respondents are willing to take the vaccine. Of course, that there are some segments of the population that are not represented here, people with no access to social media, or people with access to social media, but who are not willing to participate in this type of poll. So we don't know who these segments of the population are. So other surveys done by academic institutions, by the Penang Institute and the University of Sains Malaysia also converge in the same way to show that more than 0.5% are willing to take the vaccine. We have percentages such as 62%, and also important, we have the reasons. So why people don't want to take the vaccine, and is related mainly to the concerns about the safety and effectiveness of vaccine. So in the model that I show is more related with the trust and the confidence on the vaccine. Another study done by the National Institute of Health in Malaysia show a more positive picture. This is a study that was done in mid-2020 that 93% of the population are willing to take the vaccine, and the main reasons for vaccine refusal are also the vaccine safety, effectiveness, and vaccine side effects. So with this information, we decide to deploy another poll, but it will be a poll that will be more interactive using social media channels for youth in Malaysia. So youth is considered 18 to 30 years old. And why we decide to focus on youth? Because youth have a very important role to play in terms of disseminating reliable and accurate information about vaccine safety, because they are more educated than the older generations, and their parents and their families trust them for having access also to this information. They are more informed, not only because they are more educated, but also they are more exposed to information particularly in social media. And they are less susceptible to believe in misinformation. So we thought that it would be important to do a poll with youth in Malaysia, since this is a group that has been neglected in terms of global health studies. So we create with the UNICEF a poll in a platform that already exists in 83 countries that is called the U-Report. So the U-Report is a social messaging platform and a data collection tool that with objective of informing leaders and engaging with youth and also promoting some positive changes in communities. So in Malaysia, we have around 300,000 people in this platform, with the age groups mainly between 20 and 30 years old. And so we developed a pool that can be accessed by this link that is there. So I invite everyone in Malaysia to go to this link, and will be directed to a WhatsApp pool. And this WhatsApp pool has a conversational style that asks questions to people over 18 years old related to their willingness to accept the vaccine, but also their reasons. So we want to listen to the reasons why people are skeptical about the vaccines and the misconceptions and the myths that I've heard about vaccine hesitancy. So the objective of this U-Report pool is to engage with the Malaysian youth and to contribute to the global evidence base on vaccine hesitancy, and provide reliable information to stakeholders in Malaysia, in the Ministry of Health, in the Ministry of Science, Innovation and Technology, and UN agencies. And also in terms of our impact, we want to create a two-way channel of information. So we don't want only to listen from people, but you want to give them information that will meet their information needs and their concerns about the vaccine. So we deploy a chatbot to provide youth with this accurate information. So this is the social media interface. So when we access WhatsApp, we'll have questions related to willingness to take the vaccine, but also with what is the vaccine that people are willing to take and why, and what are the myths that they've heard, and what are the barriers for the vaccination. For example, in Malaysia, the vaccination registration is done through an app. It's called
You have a minute left, Dr. Claudia. You have a minute left.
Okay, I'm finishing. And for example, we want to understand if the digital literacy could be a barrier for the vaccine registration. So this is the back end of, we have a tool called Rapid Pro that is an open access tool that everyone can use. So we have the flows that going through there. And in terms of the results, we start this poll last week, and we have heard from over 700 youth. And there are three main themes in terms that explain the vaccine hesitancy in Malaysia. As we expect, the concerns about the safety and effectiveness of the vaccine is one of the themes. Other themes are related with the convenience. For example, youth saying that they depend on their parents for transportation, or depending on their parents to have, for them to approve that they are vaccinated. But there are also one theme that stood out, and I would like just to talk a bit about that very, very quickly. That is a theme related to youth thinking that they are not a priority. So the hesitancy is not necessarily related with concerns and fears, but from an altruistic way. So they think that they want to prioritize those in need. And the older generation in Malaysia has not been vaccinated. So they don't want to take the vaccines from them because there's not enough supply for the population. And of course there are.
Thank you, Doctor. Your time is up. We will be sharing your presentation. It's most valuable, very, very enriching. I love the three C's you gave: complacency, confidence, and convenience. You see what an amazing what media has a role in handling complacency or confidence and promote and convenience. And I think I like the reasons for the research reasons you gave for refusal was safety issues, effectiveness issues, and side effects issues. And media has such an amazing role to play in this. They play in this completely because it the kinds of stories it writes, it will either promote safety or it will promote effectiveness and side effects. But your presentation is very well researched, and the organizers, I have no doubt, AIBD will be circulating. Now, I have a question for Dr. Galeria, which has come on the chat. Now, Dr. Galeria, the question which has come for you is, and now we'll go to the questions with the remaining time, friends. All countries, Dr. Galeria, around the globe, they say, he's saying, are vaccinating their own citizens. We all are fighting a common virus. The question to you is the composition of the vaccine the same the world over? And is the effectiveness also the same? Dr. Galeria.
Thank you very much for the question. This is the first time that for one virus, we have so many vaccines. Vaccines are using the platform which are different. The basic aim of all vaccines is to produce antibodies, neutralizing antibodies in the person so as to fight the virus. But they're using different platforms. The Pfizer and Moderna vaccine are using what we call an mRNA platform. The AstraZeneca is using a viral vector platform, and the Bharat Biotech vaccine, for example, is using what we call a dead virus or an attenuated virus as a platform. So the ultimate aim is the same, and the efficacy is more or less the same if you go by clinical trials. Therefore, I think if you look at vaccines, and as was already mentioned, there is vaccine hesitancy, we should really promote whatever vaccines are available in that area, because all vaccines give acceptable protection as far as disease is concerned. They may give differential protection as far as infection is concerned, but they will definitely protect you from getting severe disease, going into hospital. And I think that we need to promote very aggressively. So vaccines across the world are effective, and they are using different platforms. And we are looking at even more vaccines coming in. As of now, more than 250 vaccines are for COVID are under trial, and almost 60 of them are undergoing clinical trials. So in the next few months, we will have even more and more vaccine coming in, and we will probably be able to look at various things like mixing of vaccines or looking at different platforms.
Thank you, Dr. Galeria. I think this is where the media needs to come together, not the Indian media or the Bangladesh media or the American media or the Latin American media. In fact, it's a time for the media also to come together and converge and give one common message to 7 to 8 billion people. I think there's a now, just as you converging regionally, nationally, I think media convergence also is needed internationally to understand that vaccine is safe wherever you are, whether you're in the north or south, developed or underdeveloped countries or developing countries. I think that's a larger message, isn't it, Dr. Galeria?
I agree with that. So I think the important message are two. One is vaccinating is very, very important. It is the best weapon that we have to fight against the pandemic. And actually vaccinating everyone is also very, very important. There has to be equitable vaccine distribution, because of the fact that if we don't vaccinate one part of the world and the virus continues to multiply in that part of the world, it will lead to new variants which will emerge because of repeated replication, which may develop what we call an immune escape mechanism and may develop resistance to the vaccine which is being given in the other part of the world. So the globe is one, we are one, and therefore we should work as a team, whether it be media, whether it be vaccine distribution, or whether it be the information that we need to give out in terms of tackling the infodemic.
Okay, great. Let me look at the second question which is coming up. It's been an honor. Dr. Galeria, thank you so much for this. As a clinician, thank God we got a clinician to explain this answer. Dr. Galeria, explain this question. I think I have something else on the chat box. Is Ashok Panigrahi saying X has taken the first dose of vaccine. Second dose is to be taken in 4 to 6 weeks. But if the slot is not available within 6 weeks, what is the solution, Dr. Galeria? One more. You said you were out of place in the group, but I think you are getting the maximum questions as a clinician.
So again, I'd like to say this is a fear which people have, that if I delay, if I don't get my vaccine for various reasons, it could be not availability, it could be you are not available at that point in time because of certain, let's say, other emergencies. You could delay the vaccine. It will not cause any decrease in the efficacy. As a matter of fact, more and more data is emerging that if you delay the vaccine by some time, it actually leads to better immune response. First vaccine dose is what we call the priming dose, and the second is the booster dose. So the booster dose can be delayed, and it doesn't have to be exactly on the same day. There is a range, and even if you go off by a few days or weeks, it doesn't really matter.
Great. I have a question. Can the question come back on the screen, please? I have to read the question. That's question to Dr. Nasrullah Muhammad Irfan, sir. How Bangladesh Betar use new media to disseminate information on COVID-19? This is to Dr. Nasrullah Muhammad Irfan. Doctor, your mic on, please. Your mic on, please, Doctor. Not Mr. Doctor, Mr. Nasrullah Irfan.
Hello, hello.
Please answer kindly.
Yeah, yes. Thank you, Kiran Bedi, Dr. Kiran Bedi. My name is Nasrullah Muhammad Irfan. I am not a doctor.
Okay, get honorary degree today.
Oh, yeah, thank you very much. Okay, actually the question, Bangladesh Betar using many platforms for dissemination the information. Number one, we broadcast our programs in medium wave and FM frequency. We have the website, we have the apps, we have the social media like Facebook, YouTube, and others, Facebook of each individual stations we have. They have the individual Facebook and they broadcast their program using social media. Right.
Okay, I have a question from Philo. Says, what about people being affected after vaccine? Who'll answer? Who's best? How about people being affected after vaccine? Dr. Guleria.
So we must understand two things. Vaccine, like I said, protect you against disease. They don't give you all 100% protection against vaccine. Yes. And no vaccine, whether you look at the international vaccine or the national vaccine, gives 100% protection. So you may still get the infection. You may still have the virus in your throat and in your nose, but the antibodies that you got from the vaccine will not allow the virus to replicate further and will not let you get severe disease. So you can still get the infection, and that is why we say COVID appropriate behavior even after vaccination is very important, because for some time you can still be infectious.
Raise your immunity. Dr. Claudia, I have a quick question and a quick answer from you, please. Question is, may I know what are your suggestions to convince the youth to be vaccinated? I asked many students, my students, and they have the same opinion as what you have showed earlier. This is from Tabil Tirmazi. Go ahead.
Thank you for that question. Yes, I think there's a misconception among youth that they think that they need to delay the vaccination. So it's important for them to understand that the soonest that they get vaccinated, the soonest the population will achieve herd immunity. And the reason why there are more skepticism about the vaccine among the older generation sometimes has to do with the logistic problems in terms of transportation and some comorbidities, and some of them they are too scared to get out of the house. So I think young people, they need to lead by example, and if the older generation see them get vaccinated, maybe that will increase the trust in the vaccine. But of course there are in Malaysia still issues with availability, so young people are not yet able to access the vaccine in the normal vaccination plan, but there is an opt-in vaccination plan with AstraZeneca that has been very successful. Thank you.
Super. Philo, if there are no other questions, may I do a wrap up? Philo, if there are no other questions, and then before we have a group photograph, Dr. Guleria, when can we be sure that we are free from the virus and we can return to pre-COVID? Oh my God. Can you be a predictor, please, Dr. Guleria?
This is a very difficult question as to say when will the pandemic be over. What I can say is, if all of us follow appropriate behavior and if we get vaccinated, we can break the chain of transmission. And if we are able to do that, the cases will come down and we will be able to come back to near normalcy earlier. I hope that by the end of the year, we will have a large number of people vaccinated, that the cases should come down significantly. but it's very difficult to predict the future.
Well, I can only predict one way. If media plays with highest act of responsibility and it kills the fake news completely and it sends more positive news. I think now the challenge is, the ball is in the court of the media. What kind of news it chooses to project as headlines, while it gives other news, but what is the headline for them? If the headline is more and more of positivity, I think we can move faster towards mental recovery, because of COVID is also an attitude. COVID is also serious attitude. So if we look at positivity and know that asymptomatic signs and symptomatic, and then the grave, I think gravity is hardly 2% or 1%. 98% is in the mind as well. Now, let me do a little wrap up before we all have a group photograph, friends. While I thank all the 4 speakers, Dr. Randeep Guleria, Mr. Nasrullah Muhammad Irfan, no doctor now, Mr. Irfan, Mr. Nasrullah Muhammad Irfan, doctor taken away. And now Mr. Boris Ramirez and Dr. Claudia Abreu Lopez. As a moderator, I want to thank all of you, all 4 of you. And of course, very soon we will have our rapporteur in Mr. KP Madhu. Also want to thank Mr. Mayank Agarwal, who introduced the show. But most of all, I want to thank AIBD for giving us a great opportunity of coming together, and to say media unites us, divides us, informs us, educates us, bonds us, heals us, hurts us, provides for us, and it also inculcates hopes, it raises fears, it gives positive news, it gives negative news. I think the ball is a lot in the court of media. Therefore, this kind of a session is so relevant in the current times, because I'm also very selective on using the news. What news do I have a choice of the channels, and I look for what educates me now rather than what scares me, so that I can nutrition myself. Back to you, my friends, Philo in AIBD. Thank you.